Hey everyone, so we're going to talk about heart failure's signs and symptoms, okay? So remember, heart failure is when the heart is not working correctly in some way so that there's not enough fresh, oxygen-rich blood making its way into all the different tissues, organs in the body, okay? So we're going to experience a significant number of symptoms from this sort of cardiovascular illness. And one of the major things that people experience is fatigue. Now, as we've said, there's not enough oxygenated blood making its way into the tissues. Oxygen is the fuel that cells use in order to do the work that they need to do. And if we're not getting them their fuel, they're not going to be able to perform at the optimal level. Right? So it's a pretty straightforward connection. When you are suffering from heart failure, you're not getting the fuel you need, and you're not going to be able to do as much as you could have otherwise. Now, the reason that happens, the exact physiological reason, is described by the word perfusion. So perfusion is this French word that basically means the movement of oxygenated blood over capillary beds. Right? Now remember, capillary beds or where gas exchange happens between the tissues and the blood. It's also where gas exchange happens between the lungs and the blood. Okay, so it's these points of exchange. And if you're not getting enough blood down into those capillary beds, that exchange isn't going to happen. You're not going to be able to get the fuel you need or get rid of the waste that you need to get rid of, which will lead to fatigue. Okay, so another problem that comes about from heart failure is what's called venous backup. So this is exactly what it sounds like. When there's a traffic jam, usually what's going on is there's a car that's broken down somewhere up the road, right? And it's causing all these cars to back up down the road. Well, that's kind of what can happen in heart failure too. Let's say that this valve is broken. Let's say it's not letting blood through into the right ventricle. Well, what's going to happen? That blood is going to go to the only place it has to go, which is back into the veins. Now, if there's enough blood in these veins are going to expand, and at some point, the fluid that's in those veins is going to make its way into the tissue. It's going to diffuse, basically, back up into the tissue because it needs to relieve some of that pressure. Okay, so that can lead to a whole host of symptoms, right? One of the symptoms that's the most prominent is what's called pitting edema. So pitting edema happens in the lower extremities. It can happen in the legs, in the feet, basically anywhere below the knee. And remember what we said. What happens with venous backup is that fluid is getting out into the tissues. This is going to become most obvious at the lower extremities, right? Gravity is always working on the fluids in our body. So the fluid is actually going to collect at the lowest part of our body. Now, what edema actually looks like is very reminiscent to what a memory foam mattress looks like. If you've ever pressed down on a memory foam mattress or a memory foam sleeping pad or pillow, you'll notice that when you press it down, it comes back up much slower than a typical pillow or a typical mattress. The same thing happens in pitting edema with the skin. If you were pressed down on the skin would rise back up really slowly. And that indicates that there's fluid on that tissue. Okay, so that's a sign of venous backup. Another sign is distension of the jugular vein. Okay, so the jugular vein runs in our neck, and it's pretty easy to see. So if you can very, very clearly see someone's jugular, and it's pretty wide and pretty noticeable, that's a pretty good sign that the blood is not able to make it back to the atrium and to the right side of the heart, that you have backup, right? And one other thing that we should talk about for venous backup is fluid is going to make its way back onto different organs. So a good example would be the liver and or the spleen. Okay, so these organs are going to be enlarged because they're keeping fluid. More fluid is being forced into them because it's backed up in the system. Okay, so upon a close physical examination, you're going to be able to see some evidence of enlargement in these organs. Okay, now let's make our way up to the lungs. Okay, heart failure, or the one that we experience most, is called congestive heart failure, right? And there's a reason for that. People who experience congestive heart failure often have a really hard time breathing. They're very short of breath. Okay, and shortness of breath is a major issue for people who have heart failure, and it's something that has to be handled very, very carefully. Okay, and basically what's happening is this. Over here we have a small diagram of a capillary and its corresponding alveoli. Now, an alveoli is the small pocket at the end of our airway where gas exchange with the blood occurs. So you have air coming in through the lungs into the alveoli, and that air contains oxygen. That oxygen is making its way into the blood. The blood that shows up at the alveoli has CO2. It has waste products that get released into the alveoli and make their way back out into the environment. Now, if we have venous backup, let's say, for example, there's a problem at the left atrium, and you have backup all the way into the capillaries in the lungs, these capillaries are going to expand. Similar to what we were talking about with venous backup and pitting edema, you can have fluid that diffuses into the alveoli. Now, that's really problematic. You can't have fluid on your lungs like that and not be short of breath. You're basically blocking some of the space that the alveoli needs to do gas exchange. So it's going to become harder to breathe. Okay, so let's talk about some other consequences of heart failure. A big one, and this is a big scary set of Greek and Latin words, paroxysmal nocturnal dyspnea. I know that P really doesn't look like it should be there, does it? So let's break this down. So paroxysmal means that it's acute, that the symptom happens really quickly. It becomes onset really quickly. Nocturnal means at night. Dyspnea means problem with the air, right? So pnea, like pneumonia, and dys, problem, right? So basically what this means is people who have congestive heart failure can sometimes suffer from difficulty breathing at night. And it happens for a really interesting reason. The body actually slows down our breathing at night because, hey, we're just sleeping. We're not doing anything strenuous, so why breathe really hard? So that's all well and good to conserve energy if you don't have heart failure. But if you do, you don't want your breathing to slow down while you're asleep. So what can happen is that people wake up in the middle of the night, they're short of breath, they start coughing. It's kind of a scary deal. Okay, so that can happen. Another symptom can be orthopnea. Orthopnea is difficulty breathing while you're lying on your back. Now you might think, oh, well, you lie on your back when you sleep. Why is that anything different? Well, here's the difference. The reason orthopnea occurs is distinct in the sense that when you lie down, blood that was pooled in your legs now has the opportunity to travel back up to your heart, right? It's not dealing with as much gravity as it was when you were standing up. When that blood makes its way back up to the heart gets sort of overwhelmed, and the heart failure that you're already experiencing gets worsened by the fact that now the heart is having to do more work than it was before. So that can also come with coughing and shortness of breath. So it's something to look out for. Another symptom is what's called crackles. So let's go back over to our alveoli here. If there's enough pressure on the alveoli, what can happen is that when there's not enough gas in here, the capillaries can force the alveoli to collapse. So they collapse, and then when oxygen or air comes back into the alveoli, they'll expand. So if you're listening to if you're listening to the lungs of someone with heart failure, you might be able to hear this little sort of pop rock sound, okay? And if you can hear that through the stethoscope, it's pretty good evidence that the alveoli are being forced shut because of all the pressure being applied to them by these sort of engorged capillaries, okay? Now, really dangerous situation that can also happen if someone has heart failure and they have capillaries that are overextended and overfilled is what's called capillary hemorrhage, which is exactly what you think it is. It's when the capillaries are so full that they burst. And when they burst, it can cause internal bleeding. There can be a lot of problems. If you're not getting oxygen to the alveoli, they could die off, which could further complicate your ability to breathe. So it's really important that blood pressure be controlled in someone that has heart failure. It's really important that we make sure that the possibility of hemorrhage is as minimal as it is. So those are some of the major symptoms and signs of heart failure and why they occur.